December 22nd, 2025. A music legend announces he has lung cancer. The discovery wasn't from a terrifying symptom, but from a precautionary scan, a spot found after a lingering cough. This isn't just a celebrity health story. This is a masterclass in modern medical detection, a story that reveals a massive, life-saving shift in how we find the #1 cancer killer. Welcome to Health Inside Anatomy and Science. I'm Dr. your name or channel host name, and today we're using Barry Manilow's diagnosis as a critical case study to explore the new front line in the war on lung cancer, how a simple scan is rewriting survival rates, why his prognosis is so hopeful, and what his story means for everyone over 50, smokers and non-smokers alike. Part 1. The Silent Killer and the Screening Revolution. Lung cancer has long been a death sentence because it's discovered too late. Symptoms, persistent cough, chest pain, coughing up blood, often only appear at stage 3 or 4 when the cancer has spread. Barry Manilow's story flips this script. His spot was found via a low-dose computed tomography, or LCTC scan, a specific type of CT scan that uses minimal radiation to create detailed images of the lungs. This is the cornerstone of a monumental public health shift: routine lung cancer screening. For decades, we had no equivalent to a mammogram or colonoscopy for the lungs. Now we do. The U.S. Preventative Services Task Force recommends annual LCTC screening for adults aged 50 to 80, expanded from 55 to 80 in 2021, who have a 20-pack-year smoking history, for example, 1 pack a day for 20 years, and who currently smoke or have quit within the past 15 years. But Manilow's case adds a crucial nuance. His spot was prompted by a lengthy battle with bronchitis. This highlights opportunistic screening, using imaging for a clinical reason that can also catch early cancer. For many, especially non-smokers or lighter smokers, this is how early lung cancer is found. Part 2. Anatomy of a spot. What is stage 1 lung cancer? So what did the MRI and subsequent scans likely reveal? The terminology is precise. A spot is a pulmonary nodule. A cancerous spot likely means a small, localized adenocarcinoma, the most common type of lung cancer, often found on the outer parts of the lung. Caught early and has not spread means stage 1A. Here's what that looks like biologically. The tumor is small, less than 3 centimeters, about the size of a peanut. It is contained within the lung. It has not invaded the main airways, the membrane surrounding the lung, the pleura, or any lymph nodes. This stage is a world apart from advanced disease. The 5-year survival rate for stage 1A non-small cell lung cancer, like adenocarcinoma, is over 90%. At stage 4, that plummets to around 10%. This is the staggering power of early detection that Manilow's story exemplifies. Part 3. The Curative Procedure: Surgery without chemo or radiation. Manilow's treatment plan, surgery without follow-up chemo or radiation, is the gold standard for early-stage lung cancer. It's a potentially curative, single-modality treatment. The likely procedure is a video-assisted thoracoscopic surgery, or VATS lobectomy. VATS, instead of a large, painful open incision, surgeons make a few small keyhole incisions. A tiny camera and instruments are inserted. This minimizes trauma, blood loss, and recovery time, critical for an 82-year-old patient. Lobectomy. The affected lobe of the lung, he has a spot on his left lung which has 2 lobes, is removed. The lungs have enormous functional reserve. Removing one lobe has minimal long-term impact on breathing for a healthy individual. The fact that he can reschedule concerts for March 2026, just months after a December diagnosis, speaks volumes about the minimally invasive nature of this approach and his excellent prognosis. Part 4. The Non-Smoker's Paradox and the Hidden Risk. A pressing question from the public will be, Barry Manilow, lung cancer? Was he a smoker? While his personal history isn't fully public, this highlights a vital, misunderstood fact. Up to 20% of lung cancers occur in people who have never smoked or are lifelong non-smokers. The causes are multifaceted. Radon gas, the second leading cause of lung cancer overall.
This radioactive gas seeps from soil into homes. It's odorless, invisible, and a risk everywhere. Second-hand smoke. Chronic exposure carries significant risk. Air pollution and occupational hazards, exposure to asbestos, diesel exhaust, and other carcinogens. Genetic mutations. Non-smoker lung cancers often have different driver mutations, like EGRF, ALK, than smoking-related cancers. Ironically, these mutations often make the cancers highly responsive to newer targeted therapies and immunotherapies, which are pills or infusions, not traditional chemo. Manilow's public announcement, regardless of smoking history, is a powerful blow against the stigma that lung cancer is solely a smoker's disease. Part 5. The Recovery and the Voice. Pulmonary Physiology Post-Surgery. For a singer, lung surgery carries an extra layer of concern. Recovery focuses on two systems. Pulmonary rehabilitation. The key is to prevent postoperative atelectasis, the collapse of tiny air sacs, alveoli. Deep breathing exercises, incentive spirometry, and early careful ambulation are mandatory to reinflate the lung and prevent pneumonia. The vocal mechanism. The surgery itself does not touch the vocal cords. However, pain, intubation, and the body's stress response can affect breath support and vocal stamina. A full return to the demanding stamina of a concert likely requires careful work with a vocal coach and physical therapist, aligning perfectly with his 3-month recovery window. Barry Manilow's diagnosis is not a tragedy, it's a testament to the power of proactive medicine, to the precision of modern thoracic surgery, and to the fact that lung cancer, when caught in its microscopic beginnings, is a battle that can be decisively won. His story is a loud public service announcement for early detection, dissolving stigma, and embracing the scans that can save a life. If this deep dive into the science behind a hopeful cancer diagnosis changed how you think about lung cancer screening, please give this video a thumbs up. It helps us promote life-saving science. Share it with anyone over 50 or with a smoking history in your life. Subscribe to Health Inside Anatomy and Science and hit the bell. We separate medical fear from medical fact. Stay proactive, get screened, and protect your health.